in obstetrics and gynecology. So this was a very important question what most of the viewers were commenting, that what is this what is why this triple marker test in pregnancy is being done, and what is this triple marker test in pregnancy all about. So in this video we'll be mainly discussing about that what is the triple marker test in pregnancy and why it is done. So basically, pregnancy, it's in pregnancy, it is this triple marker test. It is a type of a blood test in which doctors, they look at the levels of three important constituents which have risen in the blood during pregnancy. That is the alpha feto protein, the HCG hormone, as well as the estriol. So these are the three important markers what are being evaluated in this triple marker test in pregnancy, and they have their own specific role. So firstly, the first marker, that is the alpha feto protein. It is a very, very important marker which is being elevated in the expecting mother's blood, because in the blood serum, this alpha feto protein, it is being synthesized by the embryo's liver and the yolk sac. So particularly as the pregnancy proceeds, the level of the alpha feto protein in the blood of the expecting mother slowly and gradually rises, and it reaches to a peak at the second trimester of pregnancy. So once this triple marker test is being conducted at the gestational age of around 16 to 20 weeks, this can give an idea as to about the this can give an idea about the any kind of developmental defects or anomalies what are developing, which can be there in the developing embryo. So the first was the alpha fetoprotein, which is a protein what is being synthesized by the fetus's liver and the yolk sac, and its level constantly rise, reaching to a peak during the second trimester. So the first component is alpha fetoprotein. Next is the human chorionic gonadotrophin hormone, which is the HCG hormone. So this human chorionic gonadotrophin hormone, it is basically a hormone which is secreted once the expecting mother conceives. So this hormone is only found at the times of pregnancy and no other time during the lifespan of a woman. It is only during the time of pregnancy this HCG hormone level rises in the blood. As slowly and gradually the pregnancy proceeds, the amount of the HCG hormone also gradually rises in the blood. Else other times during when the woman is not pregnant, this HCG hormone can't be evaluated. It is not there present in the blood serum. The next hormone what is being evaluated in the triple marker test, it is the estriol. So estriol, it's a kind of a estrogen. It is the primary female sex hormone which is responsible for the development of pregnancy, as well as it has an important role in the maintenance of pregnancy. So a woman's body produces different amounts of estrogen at different times, and the levels of estrogen typically rises during pregnancy. Apart from this, some of the estrogen during pregnancy is also synthesized by the developing fetus. So the developing embryo, just because of it, the this that is the estriol level can also be evaluated in the expecting mother's blood serum. Now, what I need to emphasize is that this changing levels of these three constituents in blood fetus, it gives rise to certain kind of anomalies. All right. So in during any kind of a uh, anomalies, this amount of the normal values of these three particular elements, that is the HCG, the alpha fetoprotein, as well as the estriol. So the levels of these, if they are altered in any situation, if their values are fluctuating from the normal range, this is causing certain kind of a anomaly in the fetus. Apart from this, a change in the level of this is also going to cause certain kind of an anomalies such as bina bifida, as well as the neural tube defects in the baby. So triple marker test, I would like to emphasize, it is just a screening test, and this is going to only make a detection about any kind of a chromosomal abnormalities or the anomalies which can develop in the developing fetus. Apart from this, it is not a diagnostic test. The doctors are going to suggest for another confirmatory test to get the things ruled out. So it is just a screening test. It is not a diagnostic test. Moving on, now, which are the women who are more, with whom it is mandatory that doctors are going for this triple marker test? So actually, what has been found that this triple marker test is advised to the expecting mothers, only such expecting mothers which fulfill one of these following criteria. But the first important criteria is if the maternal age is exceeding above 35 years of age, then this triple mark doctor's advice of this triple marker test. Apart from this, if there is a family history of any kind of a uh, genetic diseases in the family, if there has been found cases where in the pedigree of the family there are certain individuals who have been suffering from certain genetic diseases, so in such cases also doctors they advise for this triple marker test. Apart from this, very important that in such cases it is found that there are certain women who are suffering from certain viral infections, and the drugs or medications what are being administered to them, what are being given to them, is causing any adverse effects on the developing fetus. So in such women also doctors they do advise that they should go for the triple marker screening test. Next, if a expecting mother is exposed to certain kind of harmful radiations, so if exposure prone expecting mothers are there, they also are given the, they are also suggested for this triple marker test. Apart from this, there are certain medications or drugs what the expecting mother is having, so such expecting mothers they also need to have this triple marker test done, actually, because the drugs what are being administered to them for any kind of a long term therapy such as phenytoin, anti-epileptic drugs, so such women are also predisposed to certain kind, they'll make the baby predisposed to certain kind of anomalies can develop just because of the use of those certain drugs. So such women are also advised by the doctors to go for the triple marker test. Now, triple marker test is a very important test which detects certain kind of anomalies such as the Edwards syndrome, the Down syndrome, the trisomy of the 21st chromosome, which is the Down syndrome, and it is also helpful in detecting certain kind of neural tube defects, so such as spina bifida. Now we'll look at what are the normal range of the three triple marker tests of the three constituents what are examined, what are evaluated in the triple marker test. First is the alpha fetoprotein. So the normal values, okay, so okay. So the first important work of the first important marker was the alpha fetoprotein. So this alpha fetoprotein, the normal range of this alpha fetoprotein is ranging from 10 to 150 nanogram per ml. So if the value of the expecting mother in if the value of this alpha fetoprotein in the expecting mother is below this normal range, there is a possibility that the child might suffer from Down syndrome. Apart from this, if the values they fall in the higher range, that is from the above 150 nanograms per ml, there is a possibility that the child might be predisposed to certain anomalies such as the neural tube defects, spina bifida, and encephaly. Next, it is the HCG hormone. So HCG hormones, the normal value ranges between 9,000 to 2,10,000 international units per liter, and it has been found that increased HCG hormone levels, if they're there in the expecting mother, there is a possibility, there is a chance uh, that the expecting baby is going to suffer, might suffer from Down syndrome. I'm just saying might suffer. It is not a confirmatory test. It is just a screening test. So the expecting mother, she might have a possibility that the child might suffer from Down syndrome. And apart from this, if the values of the HCG level falls below the normal range, in such a situation, it might be a possibility that the pregnancy won't sustain, because HCG is the only hormone which is secreted during the entire course of pregnancy. Throughout the entire span of pregnancy, this HCG hormone is constantly present in the blood. So if the values fall below the normal range, there is a possibility, there is a chance that the pregnancy might not sustain, the pregnancy might not persist longer. So, and last, it is the estriol. So estriol, the normal values ranges from 4 nanomoles per liter, and if this value of the estriol, which is the primary sex hormone, if this value falls below this normal range, the child might suffer from Down syndrome. So students and viewers, this was all about the triple marker test, what is being done in pregnancy. And I have tried my level best to simplify as to what are the three important constituents of the triple marker test. That is the alpha feto protein, the human chorionic gonadotrophin, and the estriol. What are their implications, what it can cause, and which women are advised by the doctors to go for the, which expecting mothers are mostly advised by the doctors to go for the triple screening test during pregnancy, and how does it adversely or affects the child. So if you still have any queries or comments, you're most welcome to comment me in the comment section. Students and viewers, if you like this video, give this video a thumbs up. And students and viewers who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Viewers, if you still have any queries or comments, you're most welcome to comment me in the comment section. If there are certain topics what you want that I should discuss it for you in whatever language, Hindi or English you want, you're most welcome to comment me in the comment section. I would be more than happy enough to discuss those topics for you. Thank you for watching.